Talking about the COVID-19 vaccines, Africa was hesitant to taking jabs, or Africans were hesitant to taking jabs. Why?
I first got to hear the word anti-vaxxer during the COVID pandemic from my medical friends. They said, oh, the anti-vaxxers have also reached Uganda, the anti-vaxxer movement. And this movement began in other countries and found its way in Uganda. A certain sector of people feel vaccines are evil, they're bad, they're not going to help. And yet, that's how a lot of us are here. When we were children, we without permission from our parents, just knew that they had to vaccinate us for measles, polio, TB, all these things. But now suddenly the anti-vaxxer movement has built up, and children are dying of diseases that they don't have to die of, yet these vaccines have been around for decades and decades. I think what made people reluctant for COVID is they felt that there hasn't been enough time to develop the vaccine. But the vaccine had been developed in other ways. There was the SARS outbreak in China in 2003. They started to develop the vaccine. Then there was other outbreaks. There was also MERS in Middle East a few years later. So the technology had begun to develop a vaccine against coronavirus, which causes SARS, MERS, COVID-19, and many other coronavirus epidemics. So our technology was already in place, and the time was right to implement it. And so it happened. And you do see that people who got vaccinated, especially in areas where there's a lot of COVID, like in the developed world, their survival rate was much, much higher than those who did not get vaccinated. So I think people realized the value of vaccinations. And after a while, African governments were like, I'm going to lose my loved one because I'm not being vaccinated. So then the anti-vaxxer, for a long time, the 1 million doses sat there, and very few people were taking them up. Luckily, NGOs like ours, we got our staff to do it. They did it, they understood it. And when they took a vaccine and went on Facebook or Instagram and people saw they hadn't lost an arm or a leg, then other people took it up. And it was through people showing, look, I'm fine, I took the vaccine, I'm doing much better, that other people did it. So I think that was also a very big opportunity for behavior change and influencing people's minds about vaccine. The leaders of the countries had to own it and say this is a good thing to do. The cultural leaders, the government, all kinds of leaders had to come up and say it's okay to get vaccinated. Then everyone else got vaccinated. We found out when we did a survey that people are very dependent on what their leaders said. And once the leader publicly got vaccinated, then other people got vaccinated. And I think that helped to reduce the anti-vaxxer movement.
There are several theories concerning the actual origin of coronavirus. On January 25th of this year, the CIA offered a new assessment on the origin of COVID outbreak, saying the coronavirus is likely, into quotes, to have leaked from a Chinese lab than to have come from animals, though the agency cautioned it had, into quotes, low confidence in this determination. Similarly, on March 12th this year, Germany's Foreign Intelligence Service, the BND, concluded that the outbreak of the worldwide coronavirus pandemic in 2020 could have well been triggered by an accident at the Chinese laboratory that does virus research. What do you think of the COVID-19 virus lab escape theory?
I would say that so many theories have been put forward about where the virus came from. But me, as a veterinarian and an epidemiologist, I would say that the lab escape theory was much less convincing. As you said in the first report, they said it had much less confidence than the others. We have seen that this virus, regardless of where it came from, has jumped from humans to animals and back from animals to humans. So we do know that it's a virus that has jumped back and forth between people and animals. And the first cases were in the Wuhan wet live market. It was a call to improve animal welfare in markets, because if it's not COVID, it can be something else. And it was a call to prevent future pandemics happening. If people just fixated with one theory which doesn't have enough evidence, then when another pandemic comes around, it's going to wipe out even more people and more animals. And so we need to look at all the options and see what we can do best. But at the moment, there've been a lot more papers which are pointing towards it coming from an animal source. The evidence is still being weighed, the research is still going on, And we hope that eventually we'll come to a logical conclusion that everybody's happy with.
Some have termed such a theories as politicization of the coronavirus origin. What needs to be done to avoid such?
That's a tough question to answer. What needs to be done to prevent it? I think people need to, as more and more papers come out, which are very valid, which have more stronger evidence towards the source of COVID, they should be broken down into information that policymakers can digest, and then they can start to understand it better. So I think there need to be stronger links between the research community and the politicians in order to prevent politicization, because it should be based on science. It shouldn't be based on propaganda or things like that, because otherwise a lot of countries suffer if you just don't base things on science.
As we discussed above, there were negative effects brought about by COVID-19 pandemic. What are some of the lessons Africa can learn? Would you say Africa is now more prepared in case there was another outbreak, such as COVID-19?
I would say that some of the lessons that we all learned was that we need to strengthen health care capacity. We need to strengthen prevention response. We need to strengthen One Health surveillance, which means not only focus on the people, but the animals, the environment, or anything else where these pathogens spread back and forth. I think it was also a very big wake-up call that we need to strengthen capacity within our countries, because a lot of the time people could not even fly abroad, So we need to strengthen our hospitals, make sure that we can address these preventable infectious diseases ourselves without having to go to another country to get treatments. Build up the traditional medicine, build up the capacities we have within our own countries, and really work hard to strengthen them. I think that it was a big wake-up call that we all have to be ready. There could be another pandemic, and we have a lot of health system strengthening to do, and also to work with other sectors like the conservation community, because diseases can jump back and forth between humans and wildlife.
Doctor, thanks very much for talking to us. We appreciate your responses, and we believe these are responses that will help shape the African health sector.
Thank you very much for inviting me. And it's been an interesting interview, and we're looking forward to seeing it. You asked very many tough questions.
All right.